Welcome to INOvators, a series where we sit down with thought leaders across the healthcare space to discuss some of the industry's most pressing topics. Today, we're joined by Todd Mersch from Microsoft, and we're going to talk about how healthcare leaders can move from innovation to impact and what it takes to make technology truly work for people and patients. Thanks for being here today, Todd.
Oh, it's my pleasure. Thank you so much for having me.
Of course. Before we dive in, tell us a little bit about your role at Microsoft and what you're focused on in the healthcare and life sciences space.
Yeah, sure. So I lead our life sciences business here in the U.S., which really encompasses everything that's not payer provider. So I have all our pharmaceutical companies, medtech companies, health technology companies, distributors, really the whole ecosystem. So it's a really great opportunity to kind of see what's going on and from an innovation perspective, how people are taking advantage of AI to drive better outcomes. So I'm just blessed to have this role inside of Microsoft.
Absolutely. It sounds very cool. You have said that organizations jump into new technologies quickly, but few are able to translate it into tangible results. Tell me what drives that gap between innovation and impact.
Well, I think people have gotten really excited about the opportunity, and that's great. So people got inspired. They're like, "Wow, we can do so much more with AI, and we can create better outcomes for the clients and the patients that we aim to serve." But that really led to some sprawl, where folks were kind of experimenting for experimenting's sake, as opposed to kind of organizing that energy towards an outcome. So I think one of the things I always tell folks is that you don't have an AI strategy. You have a business strategy. You have some things that you're aiming for to change about either how you work with your customers or in healthcare, how you interact with patients. So making sure there's a clear alignment between those outcomes and then the work that you're doing in technology. Because failure is inevitable, especially when we're doing something brand new like this. But I always say you want to fail forward. You want to fail towards an outcome, towards a goal. So if you can create that connectivity and then make sure that the folks working on the projects understand that connectivity and what a measure of success is for that, really helps to drive the outcomes that we're looking for.
And taking that a step further, when you're advising leaders, what would be the first question they should be asking when looking at adopting new technology like AI or any kind of automation?
Are my people ready? What's the culture that we need to have? How do we align this to the values of our organization? So much of this, and it always is with technology, is about so much more about culture, people, and process than it is necessarily the technology itself. So I always advise folks to make sure they think beyond sort of the cool whiz-bang tech and what does it really mean for their folks, and are you ready as an organization to scale these things?
Do you have an example of where thoughtful use of technology created a real improvement, whether that's efficiency, outcomes, experience?
One of my favorite examples right now is the work we've done with Stanford Medical System, where they've used agentic AI capabilities to help run their tumor board, which is an amazing sort of human impact story. They're able to run 4,000 tumor boards a year. For folks who don't realize, tumor board is basically bringing together experts across the care continuum for cancer. When someone's cancer either shows up in a unique way or in a person at a different stage in their life. So they come together and are able to kind of do this more efficiently, more effectively. The doctors involved in the discussion that are kind of designing that care path can focus on the conversation, not on the effort to gather all the information. And what really inspires me about this is, while Stanford has the resources to do this 4,000 times a year, there's many hospitals across the world and across the U.S. that don't have the resources to do it once. So we're working with them to now make that capability available to those hospitals so they can run a virtual tumor board and serve patients where they are.
I think it's clear the value that's showing up in those examples, but if you had to boil it down to a test, how would a leader know if a technology initiative is actually creating value?
I think going back to what I started with is you need to align these programs, these projects, to key performance indicators or what an objective and key result is that ties back to your business strategy. Every company, every organization has sort of these pillars that you define as part of your strategic operating plan. So making sure that connectivity exists, and even if you have to subdivide that and break that down to another level of detail for each project or program that you're working on, it has to be there. So, leading from the front from a culture perspective, explaining that to the people that are involved in the organization, but just keeping that front and center and connected. Because if it's not, then folks can go off and experiment and do things, but don't necessarily align to those outcomes that you're aiming for.
Well, and that kind of leads me to the next point about doing things in silos. You have mentioned that transformation isn't going to happen in silos. What do you see as the most common mistake that organizations are making when trying to modernize this way?
Yeah, you end up having folks, like you said, silos are prevalent and sometimes inevitable. We've not designed our organizations to be necessarily integrated to take on these new technologies. So sort of making sure we're breaking that down. We've even seen like technical organizations starting to have not just one CIO, but a CIO for every business function that then integrates into the business so that the business leader and the tech leaders sit together and understand both how the operations work as well as how technology works, and then go off and tackle problems together. I think kind of changing even org structures. I come from a small company background. Generally, I've been at Microsoft for about 6 years, and I'm amazed. I was always amazed when I first joined on how important the way it is you structure your organization and you structure teams. Not as important when you have 6 people, but in a big company like ours, and I think in a lot of the larger enterprises, really being thoughtful about kind of how the organization is designed to lead into the future.
Looking at healthcare organizations specifically, there is a lot of rapid change to navigate from AI, data, regulation, workforce shift. What is one mindset shift that might help them stay more adaptable?
I think breaking the problem down into pieces matters. A lot of times when, to use your saying, there's so much going on, there's so much change, there's so much opportunity, and then we almost get paralyzed. It becomes difficult to kind of move forward. So realizing that you can identify a step in the process or a particular aspect of something and design a project or a program or a technology initiative around that step. As long as you build it out as a platform, you create like a foundational layer of technology that you can iterate on top of. I think that helps. I think it helps a lot because then you're not sort of trying to, eat the elephant, as people would say. You're really focusing on a particular aspect, and the impact that you can have on a step in the process matters. I mean, there's really meaningful progress there. And then at the same time, if you do it that way, you're building organizational fluency. So folks are starting to understand better how AI can change things or how technology can change things. So then they can think about what's the next thing they can do. People are getting excited as opposed to being afraid.
And you said earlier that, people have a business strategy, but maybe not an AI strategy. So if you could redefine what a technology strategy means in healthcare today, what would that new definition sound like?
I think folks need to think about, as I said before, sort of that alignment to outcomes, and to think about sort of the thought process of how do we do this both to impact the folks that we're aiming to serve, but also to kind of change the way we operate our business. I think those two things together will lead to phenomenal impact on the business and the people that they aim to serve. I also think folks need to kind of consider how this all aligns to like their corporate values and what the company's trying to achieve from that perspective. So if you can kind of bring together people, process, and technology, really is what matters in today's age.
Well, and I like that we're mentioning, that human element, because when we talk about AI and technology, there's always that concern of, where does the human still come into play? So I think it's important to look at it more holistically. As we wrap up today, let's leave the audience with this. What is one shift that you hope to see in healthcare over the next year that would make the biggest difference for both patients and providers?
I'm really keenly focused on leveraging this transition opportunity or this inflection point with technology to help drive more equity in healthcare. And I think taking responsibility for that, not just at the delivery of care, but in the entire continuum. So I'm optimistic that all the way from early stage research into different types of therapies and technologies, all the way down to the delivery of care in the right places, and holistically, is an opportunity for all of us. So I really hope that the industry can rally behind that and really take responsibility at every stage.
Absolutely. Well, Todd, thank you so much for joining us. You've certainly offered a refreshing perspective, and, innovation truly matters, and it's when it's translated into real world impact. So thank you so much for being here today.
Oh, like I said before, it's really my pleasure. Thanks for having us. It's been a lot of fun.
Of course. And to our audience, thank you so much for watching. Be sure to follow along for more episodes of INOvators.